that. I want to bring in Jeremy Butler. He's the CEO of Iraq and Afghanistan Veterans of America. And if you will, help us to understand veterans who fought for their country, now fighting coronavirus. What is the reality right now for the veterans community?
Yeah, I think you were just touching on it on that last segment a little bit. It's a lot more complex than a lot of things that we see. Not every veteran, as you mentioned, uses the VA. I don't use it. Some that do use it only use it for a few specific conditions. So the veteran community, just like the country and frankly the world at large, is suffering in so many ways, not only from the effects of the coronavirus, and in many cases our veterans are at greater risk of not only coming down with the coronavirus, but really suffering serious effects because of it, because of the fact that not only are about half of our veterans over age 65, but many also have underlying conditions, often related to their wartime and military experience. You remember Agent Orange exposure from those who served in Vietnam. In the post 9/11 generation, we have exposure to burn pits and all the toxic materials that were burned in those conditions that result in compromised lung conditions. So you've got trouble breathing already. And then when you compound that with the coronavirus, I think we're really seeing a greater effect on the veteran community, not just from the medical side, but certainly from the physical, from homelessness, increase of job loss, and certainly on mental health toll is being taken as well.
Let me just put up for folks so they know, these are some of the numbers that your organization has put out to what you just mentioned. A 50% increase in veterans reaching out for mental health and housing needs, 70% increase those needing financial assistance, 37,000 plus veterans were homeless. During 2019, there is already a study that suggests homelessness is going to increase because of the high number of people who are out of work. Are the systems that are set up to help veterans prepared for this?
I don't think they've been prepared for this in years, frankly. Our organization, Iraq and Afghanistan Veterans of America, we have a program called the Quick Reaction Force, and the numbers you were just citing are from that program. It's a free program that any veteran, any era, any discharge status can call or log in online and connect with a veteran peer-to-peer counselor to get support. Over the last few weeks, and certainly as the virus has expanded throughout the country, we have seen serious increases in numbers of veterans reaching out to support, and that's everything from mental health care to homelessness, to job loss. All of these conditions, frankly, are getting worsened by the coronavirus, and I think what they're really doing is they're amplifying a condition that IAVA and other veteran organizations have been fighting to help rectify for years now, and that's the fact that there really is an unmet need within our veteran community. The biggest thing we're seeing right now and continue to see is in the mental health care situation. We continue to lose 20 veterans a day to suicide. We're fighting to pass the Commander John Scott Hannon Mental Health Care Improvement Act, which will really improve not only the VA's ability to support veterans with mental health care, but also those veterans who are not connected to the VA, to allow them to get connected to needed mental health care supports.
As Congress considers moving forward federal dollars that need to go to folks who have had particular challenges as a result of what's happening now in our country, both emotionally, financially, obviously a lot of money has gone to businesses. What more should the federal government be doing for veterans? What's your message to members of Congress as they consider whether or not there needs to be more legislation to help folks out there who are hurting as a result of the coronavirus?
Yeah, it's a great question. Thank you. I think the biggest thing is to remember that for every segment of the population that we're talking about from a civilian side, there are veterans within that group. Veterans are encompassing every demographic in which you could talk about. Every aspect of the American culture and society is involved in the military, and then over time is going to become part of the veteran community. We have an increasing number of women veterans, more women serving in the military and serving on the front line. So anytime we're talking about support nationally because of the coronavirus, what you're really also talking about is support to veterans. And so I think it's important to remember that, as we were discussing earlier, a lot of these situations are hitting the veteran community twice as hard, and that the VA is not the end-all, be-all of support to the veteran community. As you talked about a little bit, the VA doesn't serve every veteran. Not every veteran is eligible for VA care, and so the solution partially comes from making sure that the VA has the care and support that they need to pass on to the veterans, but also remembering that there's a lot of the veterans out there that are not part of the VA.
Jeremy Butler, thank you for being here. Thank you for your service. And it's a good opportunity to thank again everyone out there who has given of themselves to be a part of this amazing community that protects and defends us every single day, and to the families of those who are fallen, that they are in our hearts and prayers. So thank you so much. And after a quick break,